First, you're going to look at the external nose structure. Make sure it's the same color as the rest of the face. Make sure there's no bumps, bruises, cuts, lesions. You're going to palpate. Does that hurt?
No.
Nope. Not tender. Don't feel any bumps. Nose is midline. Check the patency of the shape of the nares. They want to be oval and kind of the same on both sides. You're going to, sorry, put your head back down. Close one nair and have them blow. And then the other side and have them blow. And then if you had a nasal speculum, you would check inside the nose and make sure it's pink and moist and not off color and boggy. And then you're going to check the sinuses, frontal sinuses right above the brow bone. Is that tender?
No.
Make sure there's no swelling. And then the maxilla sinuses underneath the zygomatic process, the zygomatic bone, sorry. Check both sides. Is that tender at all?
No.
And then you're going to check the lips and make sure that they're pink in color and no cuts, lesions, sores, nothing of that nature. And then palpate the lips, make sure you don't feel anything, not dry and cracked. Then have the patient smile with their teeth closed. You're going to make sure that the top teeth kind of overlap the bottom teeth slightly. And then check the gum line. Sorry. Check the gum line. Make sure it's pink in color. You can open your mouth. You're going to look at the buccal mucosa and make sure it's the same and that the gum's not retracting away from the teeth on either side. And then, sorry, you're going to palpate the insides of the mouth, make sure you don't feel any sores or lesions, and then take a tongue blade, and you're actually going to go, not yet, teeth, open. You're going to go along each tooth and make sure none of the teeth are loose, and check for dental caries or any decay or missing teeth. Stick your tongue out. The tongue needs to be midline, not tremoring. You're looking for any cuts or lesions on the tongue. You want to look on the sides of the tongue and make sure you don't see any cuts or spots on the side. Then you're going to look on the roof of the mouth. You want it to be slightly lighter than the soft palate in the back, which is going to be a more pink color. Sorry. You're going to press the tongue down, have the patient say ah. You're going to look at the uvula in the back and make sure it's midline and straight down and it's a good moist pink color, and then check the tonsils as well. Make sure they're not coming up past the tonsillary pillars. No white spots. They need to be a good pink color. Check underneath the tongue. Put your tongue up behind your teeth. Make sure you see the frenulum right here, and then that the veins on either side aren't grossly swollen. And put your tongue back down. And then I'm going to gag reflex. Don't puke on me. Push in the back. Make sure you can elicit a gag reflex. Alright?
Mm-hmm.
And that's the mouth.